Which of these examples would not be considered neglect? A. Not staying on the floor once you've clocked in. B. Forgetting to provide your resident with enough water in a timely manner. C. Leaving clutter on the floor where a resident walks. D. Forgetting to move an immobile resident enough to keep them from getting bed sores. The correct answer is A. Not staying on the floor once you've clocked in. An assistant may need to leave the floor for various reasons during his or her shift. The other options are necessary responsibilities to ensure a resident's safety or to meet basic needs. Failure in any of those areas is considered neglect. The charge nurse has administered a prescribed medication to the wrong patient. This is an example of underscore. A. Malpractice. B. Battery. C. Assault. D. Neglect. The correct answer is A. Malpractice. Administering a prescribed medication to the wrong patient falls under the category of malpractice. Malpractice occurs when a healthcare professional deviates from the standards of care in their profession, leading to harm to a patient. This scenario indicates a failure to follow proper patient identification protocols and medication administration procedures, which are part of the standard care expected from nursing and medical staff, thereby constituting malpractice. It does not constitute assault or battery in the legal sense, as these terms involve intentional harm or offensive contact without consent, whereas this scenario likely involves a mistake or negligence. Neglect refers to a failure to provide necessary care, but in this case, the issue is incorrect administration rather than omission of care. A nursing assistant threatens to slap a resident if he doesn't stop yelling. This is classified as underscore. A. Battery. B. Assault. C. Libel. D. Slander. The correct answer is B. Assault. Assault is a threat of harm, whereas battery is actual infliction of harm. Libel and slander are verbal assaults against someone's character. A resident's family is visiting when you arrive on duty and one of them hands you an envelope that contains a thank you card and a monetary gift in appreciation for your care of their loved one. The best response is to underscore. A. Thank the family and resident but tell them you must decline until you can check with your supervisor and facility policies regarding the acceptance of gifts. B. Accept the gift and then check with your fellow colleagues about how they handled similar situations. C. Thank the family and use the money to purchase a gift for the resident's birthday. D. Accept the gift and be sure this resident gets extra attention so he or she knows you are appreciative. The correct answer is A. Thank the family and resident but tell them you must decline until you can check with your supervisor and facility policies regarding the acceptance of gifts. As a paid employee for the care of the resident, it is a violation of professional ethics to accept money or gifts from a resident or their family. Some facilities allow gifted money to be donated to a fund that purchases items for the benefit of all the residents, but you need to know your company or facility policy. A particular problem can be caused accepting gifts from patients with dementia. There is a contained fire in the resident's room. What is the first action a nursing assistant should take? A. Yell for help. B. Move the resident to safety. C. Grab the fire extinguisher. D. Pull the fire alarm. The correct answer is B. Move the resident to safety. Prioritizing the safety of the resident is paramount in emergency situations. In the event of a contained fire in a resident's room, the immediate risk is to the person in that space. Moving the resident to safety ensures their protection from potential harm caused by the fire, such as burns, smoke inhalation, or other related dangers. While alerting others, pulling the fire alarm, and addressing the fire itself are crucial subsequent steps, the well-being and safety of the individual in immediate danger takes precedence. Which of these could cause a nursing assistant to be charged with battery? A. Administering medications. B. Ignoring or delaying a response to a resident's call for help. C. Using restraints on a resident without a physician's order. D. Raising a hand to threaten a slap. The correct answer is C. Using restraints on a resident without a physician's order. Restraining a resident without a physician's order is battery. Raising a hand in a threat is considered assault. Ignoring a resident's call for help is negligence, and administering medications as a nursing assistant is considered malpractice. All of these could result in a nursing assistant being charged with negligence except underscore. A. Not checking on a resident at a prescribed time. B. Not turning a patient every 2 hours as prescribed to prevent pressure sores. C. Nicking the forehead of a resident while trimming their bangs. D. Deliberately harming a resident with extreme force. The correct answer is D. Deliberately harming a resident with extreme force. Deliberately harming a resident is considered both battery and physical abuse. All of the other options are considered negligence. Your fellow nursing assistant is angry at you and lies to the charge nurse. He claims you stole money from a resident's purse. This is an example of underscore. A. Malpractice. B. Accolades. C. Defamation. D. Assault. The correct answer is C. Defamation. Making false, offensive statements about someone is considered defamation. Accolades are giving praise and compliments to someone. Assault is threatening harm to someone else. Malpractice is illegal or unethical behavior resulting in a failure to fulfill the duties and responsibilities of your position. You hear a charge nurse telling a resident that the LPN is not performing as well as she should be. The legal term for this is underscore. A. Slander. B. Gossip. C. Discrimination. D. Insubordination. The correct answer is A. Slander. Saying something malicious that destroys someone's reputation is considered slander. Discrimination is unfair treatment of someone because of prejudice. Insubordination is refusal to obey orders. While the charge nurse is engaging in gossip, it is not considered a legal term. Which of these is the legal term for being responsible for providing care according to an accepted standard? A. Slander. B. Aiding and abetting. C. Liability. D. Legality. The correct answer is C. Liability. The correct answer is liability. Legality, slander, aiding and abetting all have different legal meanings. You observe a coworker sexually harassing a resident and choose to ignore it. This is an example of underscore. A. Libel. B. Aiding and abetting. C. Cease and desist. D. Passive aggression. The correct answer is B. Aiding and abetting. When a caregiver is aware of a violation of patient rights inflicted by a coworker and does nothing to assist, it is considered aiding and abetting, or contributing to the offense. While this could be interpreted as a form of passive aggression if the caregiver who ignores the action is angry with the resident, this is not the legal term given to this type of behavior. Libel is a term used against a person who is performing the act of defamation. Cease and desist is a demand to stop doing an allegedly illegal activity and to not start doing it again in the future. When a nursing assistant restricts a resident's movements or actions without proper authorization, it can be interpreted as underscore. A. Aiding and abetting. B. Liability. C. False imprisonment. D. Slander. The correct answer is C. False imprisonment. Nursing assistants need to understand that the use of restraints without proper authorization is not the only action that can be interpreted as false imprisonment and a violation of a patient's rights. Even threatening to use restraints without a doctor's permission can result in false imprisonment charges. Another word for forcing a patient to do something against his or her will is underscore. A. Coercion. B. Collusion. C. Conspiracy. D. Consequences. The correct answer is A. Coercion. Conspiracy is a plot or secret plan by two or more people. Consequences are what follow as a result of a behavior. Collusion is secret cooperation between people to do something illegal. Which of these is a form of involuntary seclusion? A. Leaving the room when the resident wants to have private time with family. B. Leaving a patient alone without a means of communicating, such as removing a call bell. C. Closing the patient's door when he or she asks for time to be alone. D. Putting a patient in a wheelchair and rolling him or her away from others when he or she asks to be moved. The correct answer is B. Leaving a patient alone without a means of communicating, such as removing a call bell. Removing a patient's means of communication and then leaving him or her alone is considered involuntary seclusion because the patient is not choosing for this to happen. The other options are all requested by the resident and are not considered involuntary. If a resident went on a day trip with family members and returns complaining of hunger and thirst, the nursing assistant should underscore. A. Report this to the charge nurse. B. Talk to the family about the importance of the resident getting proper snacks when on an outing. C. Tell the resident when the next snack and beverage time is scheduled and get him or her a glass of water. D. Tell the resident the family who was in charge assured you they had strictly followed mealtime schedules. The correct answer is A. Report this to the charge nurse. The nursing assistant is required to report any suspected abuse, even if you suspect friends or family members of the resident. The other options do not alleviate the problem or prevent it from happening again. Which of these scenarios would most likely be considered a violation of patient rights? A. A patient is transferred from a nice facility to one that is further away and slightly less nice because of non-payment. B. A patient is receiving care from a physician that he or she has requested to be dismissed. C. Restraints are applied to a patient who has been trying to punch the nurses who are caring for him. D. The nursing assistant changes the patient to a hospital gown after others complain that the patient's lucky shirt is soiled and beginning to smell. The correct answer is B. A patient is receiving care from a physician that he or she has requested to be dismissed. The patient's Bill of Rights states that patients have the right to choose their own physician. Although patients have a right to remain free of restraints, restraints may be used with a doctor's order if the patient is harming himself or others. Patients may not be transferred without reason, but non-payment is considered a valid reason. A patient has a right to their own clothes, unless they are hazardous or infringing on the rights of others. Which of these would be an example of invasion of a patient's privacy? A. Exposing the resident's body unnecessarily when performing his or her care. B. Not knocking on the resident's door when entering the room. C. Not shutting the resident's door when exiting the room. D. Discussing the resident's dislikes with a coworker during report. The correct answer is A. Exposing the resident's body unnecessarily when performing his or her care. Examples of invasion of privacy include instances of failing to keep the resident's affairs confidential or exposing the resident's body unnecessarily, or to others, during care. It is always advisable to knock before entering a resident's room, but failing to do so is not an invasion of privacy. Unless asked to do so by the resident, it is not necessary to shut the door when exiting the room. Lastly, sharing confidential information during report is necessary for patient care, but should be done in an area in which this information cannot be overheard by non-essential medical staff or other residents. The definition of liability is A. Having insufficient knowledge to properly perform your duties. B. Being responsible for providing care according to an accepted standard. C. Lack of care according to an accepted standard. D. Participating in an unlawful act. The correct answer is B. Being responsible for providing care according to an accepted standard. Liability is defined as being responsible for providing care according to an accepted standard. Performing duties outside of your job description or performing appropriate duties incorrectly, which causes harm to a resident, may result in you being charged since you are liable for abiding by the standards of care. Which of these is not an example of abuse? A. Hitting a resident. B. Threatening to hit a resident. C. Kicking a resident. D. Startling a resident. The correct answer is D. Startling a resident. Abuse is defined as the threat of or actual physical or mental harm to a resident. While startling someone may cause them some anxiety, it is temporary and not an act or threat of abuse. Which of these is not a liable act? A. Invasion of privacy. B. Voluntary seclusion. C. Abuse. D. Theft. The correct answer is B. Voluntary seclusion. Liable acts include all of the following: abuse, aiding and abetting, assault, battery, false imprisonment, invasion of privacy, neglect, negligence, theft, and involuntary, not voluntary, seclusion. Involuntary seclusion is when you keep a resident isolated from others as a form of punishment, while voluntary seclusion is a resident's choice.